state and federal partners for the likelihood of this scenario. This declaration of a local emergency will facilitate our efforts to coordinate with all our partners and jointly implement effective strategies to protect our residents. We have a world-class health and emergency response team already engaged in the fight to mitigate the impact of coronavirus in Los Angeles County. But we need every tool at our disposal to make sure that we are ready to support any coronavirus patients who are diagnosed and to prevent any further spread. Proclaiming a state of emergency enhances our preparedness and response capabilities while also providing opportunities to seek assistance from state and federal partners. We must all remain vigilant. That means local governments, healthcare facilities, schools, community organizations, businesses, and residents must be active in our efforts to be prepared for more cases while doing everything in our toolkit to slow down the spread of this virus. That is why the board and public health are making this declaration in response and out of an abundance of caution, which will strengthen our efforts to, one, enhance our preparedness and response capabilities, to seek support and assistance from state and federal partners, and to coordinate with other jurisdictions and provide protection to our teams that are responding on the front lines. Dr. Ferrer is going to speak in a minute about where we stand locally in terms of cases, what public health is doing to protect the well-being of our community, and several steps that we all can take to protect ourselves. Public health has done a great job thus far in educating residents, healthcare workers, local businesses, and community groups about what coronavirus is and how to prevent its spread. They have been working with our federal and state partners every single day, and now with this declaration, they will have even more support. It is now my pleasure to introduce my colleague, Supervisor Solis, who has been dedicated to educating our community about coronavirus and combating the stigma against our Asian friends, neighbors, and businesses. Supervisor Solis.
Thank you, Chairwoman Catherine Barger, and also to our following elected officials, our mayor, as well as our staffs, and also Supervisor Han, who's joined us. It is one of those days that we knew perhaps this was coming, but LA County's prepared. And I really do want to give a shout out to our Department of Public Health, our director and her staff, as well as our partnership with the City of Los Angeles, as well as our partners at the federal level of government. This isn't something totally new to us, but I would say to you that we have been working, our staff behind the scenes, to understand and be prepared for what is to come. And it's not with a light heart, it's really more of a steady and, how could I say, a forward thinking of how we can better prepare our 10 million residents. In the last 48 hours alone, the LA County Department of Public Health has confirmed 6 new cases of the novel coronavirus in our community. To ensure that the county is further prepared, these 2 declarations of emergency will allow us to further draw down resources from both the federal and state levels of government. We need every tool at our disposal to make sure we're ready to support any coronavirus patients who are diagnosed and to prevent any further spread. My first priority, and I know the priority of our board, has always been to protect the public health of our residents. And I know that the public knows that we're taking this situation very seriously and taking all the necessary steps to protect the health and safety of all of our residents and our county workforce. I also want to remind people how important it is to empower ourselves with accurate information. There's been too much misinformation spreading around, and as we expected, it's cultivating fears and is leading to racial profiling. We must also ensure we take preventive measures to help prevent the spread of the virus, including washing our hands often with soap and water for at least 20 seconds, avoiding close contact with people who are sick, and to stay home if you are feeling sick. In response to a recent update from the Centers of Disease Control and Prevention, CDC, I put forward a motion that will be coming up today at our board meeting to ensure that we ramp up our preparedness efforts to prevent a wider spread of coronavirus and to access our current medical equipment and resources in place. The last thing we want to do is create more fear in our community. Fear will not drive our responses to save lives. We must combat this virus. I want to condemn any and all discrimination stemming from this situation, and we have seen the results of which include our Asian Pacific Islander communities being discriminated against, their businesses decreasing in sales to the tune of almost 60%, and also the fact that many are distressed mentally. Finally, I want to assure our residents and our workforce that we are on the front line and that the County of Los Angeles and the city and all of our stakeholders will do everything in our power to protect the public health as well as civil rights of all of our residents. Brevemente en español, buenos días. Gracias por acompañarnos a hoy. Estamos aquí hoy para asegurar al público que nosotros en el Condado de Los Ángeles nos estamos preparados para el coronavirus. No deberíamos de tener miedo del virus. Solo hemos tenido 6 casos de coronavirus en el Condado de Los Ángeles. Ellos están bajo quarantine. Oficiales de salud pública están supervisando su progreso. Deberíamos informarnos y tener cuidado. Si tienen fiebre o síntomas de un resfrío, debían de ver a su doctor o ir al hospital. Lávese las manos con frecuencia, mantengan la calma. Ahora no es el tiempo también de discriminar a ningún grupo tampoco. Lamentable, esto está pasando a muchos de nuestros vecinos asiáticos. También el condado está trabajando con oficiales federales para evitar una contaminación del virus. Yo soy autora de una moción ahora para ojalá investigar y asegurar que el condado está preparado para estar listos para el virus. Con eso, muchas gracias. Esperamos que vamos a luchar el condado de Los Ángeles combatiendo este virus. Gracias.
And now I'd like to introduce Dr. Farrar, who's going to talk to you about what we're doing at Public Health and has been truly on the phone constantly with both our federal and state partners as we move forward to address this issue. Dr. Farrar?
Sure, Barbara Ferrer. Good morning, everyone, and thank you so much for being with us. I want to start by thanking the dedicated leaders who have joined us today. Chairwoman Barger, Supervisor Solis, Supervisor Hahn, their efforts, along with the efforts of the entire board, have been ensuring all along that the county is responding appropriately to the expanding outbreaks that are caused by novel coronavirus. They've been elevating issues from the very beginning related to the inappropriate rise in stigma and discrimination and modeling the need for us to support our Asian friends, neighbors, and businesses. I'm also grateful to have Mayor Garcetti with us today. He's been setting a path that we can take so that we're informed, prepared, and thoughtful in our responses to the challenges presented by a new virus. We're also joined and really honored to have with us Dr. Go, who's the director of the City of Pasadena Health Department, and Dr. Davis, who's the health officer for the City of Long Beach. And you will hear from them about their efforts as well so that you understand we're coordinated across all of the health departments in this wonderful county. We have an amazing county team, our CEO, Sachi Hamai, our COO, Feja Davenport, my partners in the health, the new Alliance for Health Integration, Dr. Christina Galley at the Department of Health Services and Dr. Sharon at the Department of Mental Health, and also Kevin McGowan, who is the director of our Office of Emergency Management. I want to acknowledge that this is a team that has been working diligently under the leadership of our amazing board to be well prepared, and that today's actions really just allow us to enhance work that has been ongoing. I also want to acknowledge and thank all of the media, both for your accurate reporting and your thoughtful responses to inquiries. We really appreciate your ability to get information out to the general public. As Chairwoman Barger stated, in response to the increasing number of cases in the United States, our new 6 cases here in LA County, the increasing likelihood of community transmission occurring both across the United States and at some point here in our county, and the need for us to work cooperatively and proactively to slow the spread of COVID-19, the disease caused by the novel coronavirus. The LA County Department of Public Health, through the authority of our health officer, Dr. Davis, is also declaring a local health emergency today. These actions support our preparedness efforts, including effectively mobilizing needed resources and partnerships, enhancing continuity of operations, planning, and seeking and utilizing mutual aid, all in an effort to slow the spread of COVID-19 and to address any challenges that may arise with increased cases and community transmission. Emergency declarations enhance our ability as well to seek future reimbursement from both the state and federal governments should funding become available. I want to emphasize, as both of our supervisors had, that we can't do this work by ourselves, and we continue to mobilize with partners across the healthcare, business, faith-based, education, government, and community sectors to build out our plans to limit spread and protect those most vulnerable to serious illness. We need to ensure that the actions we're taking to date are amplified, as well as that we continue to make great progress educating our public and bringing people together to promote effective strategies that limit disease transmission, while also acknowledging that we need to be prepared for more cases. In the days and weeks ahead, the Department of Public Health will enhance our current activities in the following areas. We are increasing our capacity for testing at our local public health lab. Public Health is among 10 California health labs that have received CDC test kits, and we have additional kits on the way. We are currently testing and have been since last Wednesday locally for COVID-19. We will ensure that people who test positive for the novel coronavirus and their close contacts are quickly identified and closely monitored and supported while they're in isolation and or quarantined. We will start tomorrow with daily radio briefings on 3 different stations by the public health director, and I'll be joined by our health officer. We are posting new guidelines as we speak for child care facilities, schools, colleges and universities, employers, hotels, public safety responders, shelters, congregate living facilities, and parents on how they can prepare for and slow the spread of COVID-19. We continue to hold weekly telebriefings with elected officials, city managers, and leaders at businesses, organizations, schools, faith-based communities, and healthcare facilities. We are in contact with over 3,500 leaders and administrators across the county on a weekly basis. We are holding an educational webinar for all of our skilled nursing facilities at the end of this week so that they too can make sure they're adequately prepared for the possibility of cases within their facilities. We are sending out technical assistant teams starting today for site visits over the next week to every single interim housing facility to assist in the implementation of environmental practices and modifications that can reduce transmission of respiratory illness in our congregate living facilities. We're communicating and preparing with our first responders, healthcare facility partners, and healthcare providers to make sure that we have continued readiness for this dynamic situation. Paying a lot of attention to making sure we have adequate personal protection equipment for our wonderful and dedicated and skilled healthcare workers. Protecting our workforce, our healthcare workforce, is a high priority. We are updating our pandemic response plan for COVID-19 in accordance with CDC guidance and local conditions, and working with the Office of Emergency Management We are opening our EOC today to coordinate across the city departments. I want to give a brief update. As you know, there are increasing cases of COVID-19 across the United States. Today we're announcing 6 new cases. We've confirmed these cases as of last night with positive lab results from our local lab, and we have completed investigations. All of our cases, all of our 6 new cases, are linked to an assumed known exposure. There's either a travel history to an area with an outbreak, there's exposure to known travelers coming from areas where there's an outbreak, or the person is a close contact with a confirmed case. I want to repeat, we have information that allows us to announce that we know of an assumed known exposure source for all 6 of our new cases that we're announcing today. This means that as of today, we still don't have known cases of community transmission. Like other large jurisdictions, we anticipate more local cases. This is because there are increases in outbreaks all across the world, and the fact is that people who are in close contact with folks who are infected with novel coronavirus can themselves become infected. We know that we have effective public health interventions that slow the spread of infectious diseases, especially when we're all working together. So what can we all do? I want to start with what's most important. Stay home if you're sick. Sick people make other people sick. That's the main route of transmission, a sick person coming into contact with somebody who's well. So if you're sick with anything, including mild illness, we need people to stay home. We need people to wash their hands with soap and water for at least 20 seconds frequently. We need people to cover their coughs or their sneezes with tissues and then throw those tissues into the trash and wash your hands. We know it's allergy season here in LA County, but we still need people to adhere to common sense public health practices. And there's still time for people to get immunized against the flu, and we encourage this. As many cases as we have of influenza, reducing that number reduces the burden and the stress on our healthcare system, which will see more need to respond to the increasing number of cases of COVID-19. We also ask that the public plan for the possibility of more extensive social distancing requirements. These measures would include having an ample supply of essentials at home, no different than the preparedness activities we ask people to do to be ready for natural disasters, earthquakes, fires, floods, mudslides. We do need folks to plan for the possibility of business disruptions, school closures, and modifications or cancellations of select public events. We will be working closely with schools and public event venues and businesses before decisions are made to close. But this is the time for people to have a plan of what they would do should their child's school need to close. We ask everyone to start practicing sort of what we call simple social distancing practices. Use verbal salutations in place of handshakes and hugs. Don't share utensils, cups, and linens. And whenever possible, try to keep 6 feet between you and other people that you don't know at large events. If you're an organization, a business, a human service provider, there are additional strategies that we ask you to adopt. We need you to make sure that your bathrooms are well stocked and can support hand washing. We need folks to take a look at their sick leave policies so that they're flexible, non-punitive, and consistent with public health guidance. Implement plans that allow people to stay home if they're mildly ill without the risk of being academically or financially penalized. Make sure at your business and at your organization's location that you're performing regular cleaning and disinfection for frequently touched surfaces. Ensure that your continuity of operation plans are up to date so that your essential functions can continue should you see large numbers of people that are sick and unable to get to work. And we ask that also leave policies be modified so that we don't require a doctor's note for staff returning to work after being sick wherever possible. This reduces the strain on the healthcare system for people with mild illness needing to come in to get their doctor's note. Everyone should be aware of scammers who are spreading false information, particularly those that are trying to sell medications and treatments with promises of cure and protection. There are no specific medication treatments or vaccinations currently available and approved for treating or vaccinating against COVID-19. As always, we ask you to check with trusted resources for accurate, up-to-date information about novel coronavirus, and use our website, publichealth.lacounty.gov, for information about increasing numbers of cases or information about steps and guidance for efforts you can take to protect yourselves and those that you love. I want to thank the supervisors and the mayor for their leadership and their support for public health efforts. I want to thank all of our partners, especially the cities of Long Beach and Pasadena, for all of their support. And I want to really close by thanking the general public for doing what you can to stay informed and protect yourselves and help us slow the spread of respiratory illnesses in our community. Thank you very much.
And now I'd like to introduce the mayor of the city of Los Angeles, Eric Garcetti.
Thank you so much, Madam Chair, and let me just say how what a joy it is to serve with you and Hilda Solis and Janice Hahn, the Board of Supervisors. In so many places where jurisdictions are divided, we are so united, and thank you for your leadership and close coordination. And thank you, Dr. Ferrer, too, for your exceptional leadership here for all the residents of the County of Los Angeles, as well as your national leadership as part of the ongoing conversation around coronavirus and COVID-19. We've come together across Los Angeles County this morning to offer this information, this guidance, and I hope some reassurance to the residents of Los Angeles about COVID-19. We've all seen the headlines and followed the news. We know the threats that this virus has introduced to communities, not just here in this country, but around the globe. But our main message is that the City of Los Angeles, other cities in the county, and the County of Los Angeles have done everything possible to be ready. But this is everybody's responsibility. We have to be prepared. We have to protect the well-being of our loved ones and our neighbors. But before I say more about the things that we're doing in the city, I think it's very important for us to also recognize that this isn't just something for government to do alone. That it's critically important in our workplaces, critically important in our households, that we each take responsibility for slowing the spread of what we know is now here and will be here, to limit our own exposure, but not to panic, but instead to be prepared. This morning I signed as well, in coordination with Supervisor Barger being in touch with me, a declaration of local emergency for the City of Los Angeles. This is important. We're not saying that the situation in Los Angeles is dramatically worse. What we are saying, and this echoes what the CDC is saying, that the potential public health risk is elevated and significant. We expect to see more cases, as we announced here today, this week. And this state of emergency is the most powerful tool we have at our disposal. And I want to go out of my way to thank our federal officials we've been working with as well. And the CDC and HHS, for us at the airport and the port, our Coast Guard and our CBP officials, who have really worked to make sure that ships that are coming into the port are screened, that passengers that are coming through LAX are being screened, the fourth busiest airport in the world and the busiest container terminal in the Americas. Our response will continue to be collaborative, and I want to thank also Governor Newsom and our state officials. We have worked together. But my declaration today, together with our City Council, and I've been in close touch with our Council leadership and our President, Nuri Martinez, directs the Emergency Management Department of the City of Los Angeles, which we've activated now for over a week at a level 3, which is the lowest level but still an activated level, to coordinate the city's planning, preparedness, and response efforts with the LA County's Department of Public Health and the Office of Emergency Management. It also directs each city department, from our libraries to our rec and parks facilities, our firefighters and police officers, to look at their continuity of operations plans. Should things be worse, and I talked to an epidemiologist at UCLA yesterday who said this could be much better than we expect, it could be much worse than we expect. Anybody who says it will be one way or the other, we simply do not know. But we do know that there will be folks that work for our governments that will be tasked with being the first responders and need to be educated on what to tell somebody who comes to a library, somebody who on a 911 call that they're answering that they come into contact with, and we want to ensure their health and safety as well as their ability to communicate. As I mentioned, at LAWA, we're working with Customs and Border Protection and the County Department of Public Health to protect travelers, as well as everyone who works at LAX. We've been wiping down high-touch areas, escalators, elevator buttons more frequently, 250 new hand sanitizing stations, and the CDC is of course, continuing to screen all international passengers who have been to China in the last 2 weeks. Following the guidance of public health professionals, LAWA is also providing gloves to all of its cleaning crews, training LAX employees on how to respond if they encounter a traveler they believe has the symptoms of COVID-19. Together, these will help us slow the pace of spread. And I want to urge everybody to do what the city and county are doing. Follow those guidelines of the CDC. Check out the website of the county, and we have a link to it on our city homepage now as well. Wash your hands regularly, stay far away from people if you can, and do all the things that have been mentioned. And for those residents of the City of LA to sign up for emergency alerts at notifyla.org. I'm just going to skip ahead because I know we have other cities as well and say a couple things in Spanish. Muy buenos días a todos. Nos hemos reunido con el Condado de Los Ángeles por ofrecer información, orientación y yo espero más confianza sobre el nuevo coronavirus. Este es un momento para que nosotros tomemos la acción que sabemos va a limitar la posibilidad de exposición y evitar que el coronavirus se convierta en un problema mayor. Este es un momento para prepararnos, no para sentir pánico, porque cuando estamos preparados sabemos lo que tenemos que hacer. Estamos preparados para tomar acción. Por eso esta mañana yo firmé una declaración de emergencia local para la ciudad de Los Ángeles. Esta declaración nos ayudará a evitar la pérdida de tiempo precioso para poner las cosas en orden. Nos proporciona el acceso a fondos adicionales a nivel federal y hará que la ciudad sea más rápida y ágil en nuestra respuesta. Puedes y debes también tomar estas simples precauciones de salud. Lave sus manos regularmente durante los menos 20 segundos. Evite tocarse la cara y si se siente enfermo, quédese en casa. Esta es una situación que sigue evolucionando y no sabemos exactamente qué esperar, pero puede decirle lo que sí sabemos. La ciudad está preparada, el condado está preparado para proteger la salud y la seguridad de cada persona que vive, trabaja y visita a Los Ángeles. Gracias.
It's now my great pleasure to introduce Dr. Go, who's the health director and the health officer for Pasadena, for the city of Pasadena.
Thank you, Barbara. Good morning. I'm Dr. Ying Go. That's spelled capital Y-I-N-G dash capital Y-I-N-G-G-O-H. Director and Health Officer of the City of Pasadena Public Health Department. Since 1892, the Pasadena Public Health Department has worked to protect and improve the health of the Pasadena community. The City of Pasadena is one of 3 cities in the state of California that maintains its own independent local health jurisdiction. As the City of Pasadena Health Officer, I will be declaring later today a public health emergency for the City of Pasadena. There are currently no confirmed cases of COVID-19 in the City of Pasadena. This declaration is part of an ongoing response and will empower the city to more effectively respond to COVID-19 and prepare for community spread of the virus, maintain coordination with our partners, seek and utilize mutual aid, potentially obtain reimbursement, and ensure that the city's health professionals and other local stakeholders have all the necessary tools at their disposal. We are working in partnership with city staff across departments, local healthcare workers, and county, state, and federal agencies daily. We have confidence in our community's medical systems of care and in our partnership with our healthcare providers to address this outbreak. I will be providing a full report to the Pasadena City Council Monday night, March 9th, at the council meeting. Thank you.
Thank you so much, Dr. Go, for all your support and for your collaboration. I now want to introduce Dr. Davis, who's the health officer for the City of Long Beach. Dr. Davis.
Thank you, Barbara. And thank you, supervisors and mayor and Dr. Muntu Davis for having us, having the City of Long Beach here today. I'm Anissa Davis. I'm the City Health Officer for the City of Long Beach Department of Health and Human Services. In alignment with Los Angeles County and the Los Angeles County Department of Public Health, the City of Long Beach and the Long Beach Health Department, Department of Health and Human Services, plan to declare a health emergency and a local emergency later today. Although there are no cases of COVID-19 in Long Beach at this time, this declaration will assist the city and the health department to continue to enhance our preparedness activities in order to effectively respond to cases of COVID-19 in Long Beach should they occur. Thank you.
So now we will open it up to questions if anyone has any questions. Yeah.
Sure, those are great questions. So let me start with the total number of cases for LA County is 7. We had our first case back in January. That person has since been cleared. They're no longer infectious. And a reminder, that person lived in Wuhan City and was a traveler. So these are our first new cases, and they obviously all, as we're seeing, as we're doing more testing and as there's more transmission across the country, we're going to continue to be reporting on these new cases. There's one person that is hospitalized, and all of our other 5 new cases are being isolated at home and closely monitored by the Public Health Department.
And you said it's a single exposure known for each of these cases. Does that mean it's a single different exposure? One exposure source?
Sure. No, that's a great question. 3 of, I'll give you a little bit of information. 3 of the new cases were travelers who were traveling together in northern Italy. One of the new cases is a person, 2 of the new cases are family members who were in close contact with another family member who does not live in LA County but lives elsewhere, but was tested and was positive for the virus. And the last new case is in a person whose job at the time exposed them to travelers from other countries who may have been infectious. Yeah, so the tests are the tests so far have been very reliable, so that's a great question. We are currently using the same testing protocols that the Center for Disease Control uses in Atlanta. So this is the same exact test. The test kits actually come from Atlanta. We have plenty of capacity to do the testing that we need to do at this point in time. We anticipate no shortages in kits here in LA County. We also have a sophisticated lab and are working to design an alternative test strategy so that we would be able to have a backup for testing should there ever be a shortage of reagents with the CDC test kits. So yes, we have capacity here and we're testing. I do want to remind folks that the testing is all done under the guidance of the Centers for Disease Control. They have actually sent out the guidance to us and to healthcare providers about who should be tested. Obviously, there's flexibility, and we always rely heavily on clinical decision-making by the provider that's treating a particular patient as sort of the last person that gets to make decisions about that person's care. I think we have flexibility here locally to really pay a lot of attention to what the literature is telling us and the experiences in other countries about when to test and the usefulness of testing. No, the test kits will be going to laboratories. So I want to be clear, this isn't an at-home test at this point in time. These test kits are distributed to sophisticated labs that are able to do a sophisticated analysis to determine whether or not there's a positive case. The CDC and the FDA are working with commercial labs so that there'll be additional capacity through commercial labs. But again, these are sophisticated test processes, and this isn't a home test kit. Yes, the taking of a specimen, which we call a swab, is in fact done by healthcare providers. So yes, and that capacity exists for healthcare providers who can follow the protocols on how to do this test. No lo voy a hacer acá, pero sí vamos a hacerlo después. Hang on a sec, I'm going to go here. We're able to test hundreds of people.
How many so far, Doctor? Knowing the specifics of the 7 cases that you have now, realistically, what is the concern with the homeless population? Is that top of mind at all?
Sure. There are populations that we are worried about because they're more vulnerable. Those are people who have underlying health conditions and the elderly. And obviously, many of our people who experience homelessness are in poor health conditions already and have chronic health issues. So we are concerned. As I noted, we are going to be doing technical assistance at all of the shelters and interim housing facilities to talk with those providers about how they can best help us minimize having sick people in very close contact with well people. We're also working with the Office of Emergency Management to have solutions for the situations where we have unhoused homeless people who need a different level of care and or isolation and quarantine. I think the mayor said it best, that, we would love to have the crystal ball and be able to tell you sort of where this is going, who's going to get it. All we can do is learn from experiences in other places where there have been outbreaks. So we're doing a lot of work with our homeless services providers, and we're doing a lot of work with those people who care for the elderly. Not because we know for certain that it will show up in those populations, but more because we know if it does show up, those people are at higher risk for more severe illness. The cases are throughout the county, and we don't give out specific locations. So remember that there's a lot of different kinds of respiratory illness. So when someone comes in, if they have respiratory illness and they come into an emergency room, there are protocols in place at all our hospitals to quickly isolate people and mask them so that they don't, in fact, pose a potential risk to others. There are strict protocols for healthcare workers that would be doing any testing, but that's a clinical assessment. I want to be really clear, every single person with respiratory illness will not and does not need to be tested for novel coronavirus. There's a very small group of people for whom that test is appropriate. The vast majority of people who we have tested since January for novel coronavirus, actually up until yesterday, were all negative, and that was over 24 people. So the vast majority of people who even met the testing criteria were in fact negative. Many people who come through with respiratory illness are in fact sick with other kinds of respiratory illness. We are in the middle of influenza season, and that is the leading diagnosis. So people will get treated appropriately depending on the clinical judgment of our wonderful and esteemed healthcare providers throughout the county. So,
You know what? We're gonna take one more call, and then Dr. Farrar will be available.
I'll be available.
I just wanted to ask you, what about sports events? All those people?
Yes. So we have obviously done a briefing with the large venues. We have asked them to make sure that they too are well prepared and that they're making it easy for people to practice our public health hygiene. So right now, the most important thing is that there be good access for hand washing. If at any point we think that there's good reason for us to be worried about extensive community transmission. They have been alerted to the possibility that we may ask for modifications at large public events. This could be that games are played, but there are no spectators. This could be that there are limits to how people are going to gather and at public events. But I want to reassure everyone, we are not there today. We don't have community transmission that we know about today. What this is a call for preparedness. No surprises. Know what you might do should we see an explosion of cases and we come back and we suggest that public health strategies would have us do more extreme measures of social distancing. Right now, the most important thing is for people to do what we know works. Stay home when you're sick, wash your hands frequently, avoid contact with other sick people, make sure that where you can, you are keeping your distance from people you don't know, and again, stay home when you're sick. Sick people make other people who are well sick. So most important message today is for sick people, even with mild illness, to stay home. I'll take questions offline.
Yeah. Thank you all very much. Thank you. And there is a fact sheet on the public health webpage that will answer a lot of the questions in terms of what to do and how to be prepared.
Can you address the voting issue?
No. We're going to board meeting. We're going to talk about it.
Ms. Barger?
Yeah.
Is it fair to say that the 6 new cases were